Greetings, YouTube. Now, if for some reason I had to pay for my own health care, all by my onesies, that would be prohibitively expensive. I couldn't do it. You go call up Blue Cross and Blue Shield and ask them how much an individual plan costs, and you will be stunned. But if, say, I worked for a company that had 50 employees and all of us were on the same insurance plan, things got a little better. A 50-person block has much better bargaining power than a single person does, who essentially has no bargaining power of any kind. You are a beggar in that regard. And if you work for a company that has 500 employees, things get easier. 50,000 employees, and it's downright affordable. So imagine what would happen if you were a part of a block of citizens that comprised 180 million people. 180 million people wouldn't just be a strong bargaining position. 180 million people would be telling the healthcare providers what to do, and they would be falling over themselves to do whatever we asked. Because 180 million people is so much money, even if each individual paid a very small amount, that any healthcare provider that signed on board would be rolling in clover forever. You see, what I just described is a single-payer healthcare system, a universal healthcare system, one where every working adult, which is roughly 180 million Americans are in the working adult category, would pay into it through our tax dollars, and it would provide health services for 308 million Americans. I believe that the population is currently 308 million. So not only would we all have lower costs, but we would cover everyone, every child, every worker, every person that was infirmed or handicapped or elderly. Everyone would have health care. And we would pay less than we are right now as individuals and as a nation. Because those 40 million Americans that have no health care right now, when they get sick, we end up footing the bill anyway. Because they go to emergency rooms, they don't have a doctor to see on a regular basis, so their costs are always astronomically high. Numerous small visits to a doctor are much less costly than a few pricey visits to the emergency room. Everyone knows that. The old ounce of prevention beats a pound of cure concept? Yeah, it actually has real-world economic effects. But in America, we've decided that being healthy is a commodity, even though that's a violation of the UN stance that access to healthcare is a human right, because, well, it is. So I'm going to link to an article that deals with this particular topic. And there's a final paragraph in this article which really sums things up beautifully for me. So I'm going to read it to you. In every other advanced country, the provision of universal access to medical care is a public responsibility. In every other advanced country, this principle has been accepted by the mainstream Conservative Party. Only in the United States does the Conservative Party uphold the operating principle that regular access to doctors and medicine should be denied to large chunks of the population. This sort of barbarism is unique to the American right. And that is exactly what it is, folks. Barbarism. And so long as we fight tooth and nail to avoid a single-payer universal healthcare system, America is showing the world that amongst the quote-unquote civilized first world nations, we are the barbarians.